you for having me.
Okay, welcome everyone today. I'm Peggy Dadermeyer. I'm the Director of CARES at the Hope and Healing Center. And for those of you who aren't familiar with the Hope and Healing Center or our services, the Hope and Healing Center is a mental health outreach, and CARES is an acronym for Caregiving, Aging, Resilience, Ethics, and Spirituality. And we provide education and training and one-on-one coaching and various support groups for all things aging and caregiving. And we welcome you today to our monthly Lunch and Learn. And our guest speaker today is Tanisha Roberts Glover, and she is with the ADRC, with the Houston Health Department. And I'll let her tell you about herself and her work and her department's work, and we'll get everything started. Welcome, everyone.
Good afternoon. Thank you so much, Dr. Peggy, for having me today. My name is Tanisha Roberts Glover, and I have been with the City of Houston's Health Department for going on 8 years, working exclusively with the ADRC, and the ADRC stands for the Aging and Disability Resource Center. One thing that I will share with you that I shared prior to the meeting was that we are, our other name is Care Connection. The Aging and Disability Resource Center. That's how you're able to find us, especially on the Health and Human Services website. If you go to Health and Human Services website and it says something about, are you looking for an Aging and Disability Resource Center, you will find us that way. But one thing that I shared with Dr. Is it Dettermeyer?
Say, yeah, call me Peggy.
With Dr. Peggy was, we are the No Wrong Door. And so to give you an overview of what ADRC does is, I want you to remember that we're no wrong door. And so what that means for people is we seek to help people in their many frustrations when it comes to long-term care. People, family members who experience or are going into the long-term care mode and you have questions, we're the ones that you reach out to. Serious story, my mother is turning 70 on Saturday. And so this morning on my way to work, we were having a conversation and she said, I think I'm gonna need Medicaid. Well, my mom's still working. My mom and my bonus dad, they're both still working. And so as we were talking, I said, I think we're gonna have to have a conversation. And this is typically how it starts out for long-term care, is a conversation. And so as we began to talk, I said, Mom, it doesn't sound like you need Medicare. It just sounds like once you prepare to retire, you need to choose if you want to keep Medicare, the original Medicare, or go into an Advantage plan. And she was like, oh, but that's how our conversations start with the ADRC, is simple questions about Medicare, about Medicaid. What do I do? Do I need long-term care insurance? Is there a way? What am I going to do if I need assistance in the home? These are the complex questions that we assist people in answering. So in a brief overview, that's what the ADRC does. And so again, it's a nationwide dialing system. So when I refer to Health and Human Services, a lot of times people, when they have questions about Medicare Medicaid or Medicare, if you have questions about Medicare, if you are computer savvy, you're going to go to Medicare.gov, right? If you have questions about Medicaid, then you're going to go to Health and Human Services to look up information about the services that they offer. When you go to Health and Human Services, you will see a number and it'll say 1-855-937-2372. That's the nationwide dialing system, which means this, depending on what your zip code is, they will route you to the correct Aging and Disability Resource Center so that you can get the assistance that you need. So the mission for ADRC Care Connection is to reflect the national vision of assisting any person with any disability, adults who are older and caregivers. That goes for children. We are partners with Health and Human Service Commission. And so because we're also a part of the City of Houston's Health Department. So our job is to help our partners in delivering the best navigation and making sure it's not fragmented. And our vision for the ADRC is to help take the important steps of the Administration on Aging and the Centers for Medicare and Medicaid by creating a person-centered, community-based environment that promotes independence and dignity for individuals. I think that a lot of people see going into a nursing home or an assisted living facility as their end days. So the focus is always going to be on making sure that a person that is getting older that needs services has the best opportunity in life. If that means that it's community based and they're at home and they're receiving services in home by a caregiver, then let that be. If it's receiving respite, these are all long-term care components that assist people in being able to stay in their homes. And providing our values are providing resources and values and services that support the needs of families and the caregivers. Individuals trying to access a multitude of LTSS options, which is long-term care services, find themselves confronted with a whole lot of information and not knowing how to work through it. And so at the ADRC, our job is to help them navigate through a crisis, navigate through the forms and anything that has to deal with the long-term care portion, whether it's leaving the hospital, trying to find home delivered meals, trying to find incontinence supplies. That is what we attempt to assist them with. Okay, so now I'm going to introduce you to our staff. This is our director. This is Carmen Castro. She's a division manager, and she's a division manager for the Harris County Area Agency on Aging, as well as the Harris County Aging and Disability Resource Center. How does this work? You have a big sister and a little sister. So because she is the division manager for the Area Agency on Aging, the Area Agency on Aging deals with everything 60 and above. The Harris County Aging and Disability Resource Center deals with everything 59 and below. And so you have them all together, right? So if your consumer or your father is 75, you can easily call the ADRC and we will make sure that you're connected with the Area Agency on Aging. If you have a 25-year-old and you just have one number, let's say it's the Harris County Area Agency on Aging that is autistic, you can easily call the Area Agency on Aging and they're going to connect you with the ADRC. It doesn't matter. We're going to mesh together. And it could be a sandwich household where you have a husband, a wife, children, grandparents, all in one, and there's more than one need for services. So whatever you need on one side, you're able to receive, and whatever you need on the other side, you're able to receive. Our goal is to work together for the benefit of the community and the families. And here I am. I am a housing navigator, a local contact agency specialist. I also work with all of us, and I'm also a benefits counselor. So remember, I told you I've been with the ADRC for going on 8 years. So with every piece of information, it allows me to gain a better understanding of the different programs. And this is Erisbel Vargas. She's an information and referral specialist. She's a community partner specialist with the state of Texas, and she's a coordinator for road and transportation. A community partner specialist means that she assists people applying for Medicaid or SNAP benefits. And our road and transportation, you'll find out a little bit about that as we go further. And this is Ernesto Perdomo. Ernesto Perdomo is an information referral specialist. He's also our respite specialist, and he also does our social media. And this is Carmen Mercado. Carmen Mercado is an information and referral specialist. She also has been added onto our outreach, and she assists Ernesto with our respite program as well. This is Tracy Flemings. Tracy Flemings is a customer service 3 and outreach specialist, and he also is a veteran specialist, and he assists me with housing navigation. Combined together, these are our services that we offer. So one of the first services that we would like to tell you about is our respite care. Respite care services include vouchers that can be used to pay for someone to come into the home to give caregivers a break. The vouchers can also be used to pay for services outside the home, such as camps for children, daycare services for adults that allow caregivers to leave their loved ones with a certified individual so that they can take a break. Okay? And the name of our program is Lifespan Respite. So how does one qualify for the respite care program? One, you have to be a caregiver. And this is the most important part. This is not for the care recipient. This is for the caregiver. So when you call, if somebody calls and they say, hey, my mom needs, she needs somebody coming in home to help her a couple of days a week. Well, what we're going to tell them is you need to call 713-692-1635. Does anybody know what number that is to? That is the intake number for Health and Human Services. And why would we say that? Because you're asking for services for someone that needs help. We want to help the person that's giving. That's the part, is giving. The caregiver is the giver. That's the one that's fixing the meals. That's the one that's helping mom change. That's the one that's spending all their time with the person that has a disability or has a chronic condition. So that's the most important part of it, is the caregiver, okay? Second, a caregiver or a care recipient is currently not receiving respite or provider assistance through the Department of Aging and Disability the Department of Aging and Disability Services, which should be Health and Human Services. They're not receiving any services from the local mental health or or IDD services, and they're not receiving services from the Area Agency on Aging. Okay, so if you know somebody that might qualify for this, then you see our number down there. It's 1-855-937-2372. They'll do a little bit more extensive assessment on that, but those are the main requirements. So as long as they're not receiving services from anybody else, and a lot of times you'd be surprised. So what we've been getting is an influx in calls for people that are not U.S. citizens that are disabled that need assistance. We're able to assist them because most of the time they won't qualify for certain services, right? So that's something good to know. Okay. And so our next program is our roadie transportation services. We have a program, it's through rides. And it is for people who are disabled that, may face issues with wheelchair accessibility or something like that, just getting back and forth to doctor's appointments. We have that. Our program is specifically for people who are 59 and younger. So anybody 59 and younger who doesn't have any other programs or anything like that, they're more than welcome to call us. Or I think that they can't be a part of, what is it? I think it's MetroLift. I think it's MetroLift that they can't be a part of. I'm not sure. Don't quote me on that, but I'll find out for you. Um, and it's to get back and forth to doctor's appointments. Now, this is the good part. Let's say they need to go pick up a prescription, right? And a lot of people get their prescriptions from Kroger or HEB. You can go in there, wait while you waiting on your prescription, pick up your groceries. It works like that. If your doctor's appointment is close to a store or something like that, you can go get your things and then um, go on back home. So that's our roadie transportation. And rides, it's like I stated, it's rides for people with disabilities or older adults. And the key thing is that I forgot to tell you is they have to live in Harris County. So in order to get this transportation, they have to live in Harris County. Now, the travel within Harris County, let me check on that because I do know that they do make exceptions, like there are annexes in Harris County, right? And so the areas that are annexed, I believe that they can, if they got to go in Fort Bend, they can go in Fort Bend. The key is that they're not, if they live in Katy and they got to go to Woodlands, this would not be a good transportation program for them because I think it has to be in a certain mile radius for it to be beneficial for them, because the transportation they're charged per mile or something like that. And so you want to make sure it's beneficial for them. Now, if they just want to go one time, then, that's fine also. But they are given a certain amount of money on their card so that they're able to go back and forth to their doctor's appointments or to get prescriptions. And another program that we have is our special Medicare programs. Now, this is for benefits counselors, which I am a certified benefits counselor, but we do assist with Medicare Extra Help program. And Medicare Extra Help program is the programs that assist Medicare beneficiaries in paying for their deductible, their premiums every month, right? There are some programs that just pay the premium. There's some programs that pay premium, doctor visits, and prescriptions. So we do assist with helping them apply for those programs. And as I just said, the Medicare Savings Program I think there's 4 programs in total. It's the QMB, which is the Qualified Medicare Beneficiary Program. And that program is the one that would help them pay for their premiums as well as their doctor's visits and help them pay for prescriptions for Part A and B premiums. Typically, you don't have a Part A, but that's another story. If someone has any questions, they're welcome to call me and we can discuss it thoroughly. But there's QMB, there's SLMB. SLMB is a specified low income beneficiary, Medicare beneficiary, which is they pay the Part A and Part B premium or deductible. And then there is QI, which is a qualified individual. The qualified individual is, it's on a first come, first serve basis because they can make a little bit more money, but it only pays the Part A and Part B premium in there. And then it's the last one it's QWDI, I think, like it's qualified working disabled individual, which is a program if someone is working and they are receiving Medicare, this program helps them as well. So I am certified to assist and willing to if need be. Okay, and this just gives more information about the special Medicare programs. And so for one, you have to have Medicare in order to qualify for any of them. And because it is a form of Medicaid, anytime you deal with Medicaid, and I don't know if you know this or not, but always remember Medicare is the red, white, and blue card that you get whether either you're disabled or you're 65 and older, right? But Medicaid is always going to be income-based. So Medicaid, always remember that Medicaid is always income-based. And so that's the part that we assist with. And when I say assist, I mean helping them fill out the applications and gather the forms that they need in order to see if they qualify for these programs. Okay, and options counseling. This is one of my favorite parts that I think I like about Care Connection. It's what I call, it's those talks where you lay everything out, and we have these a lot with people getting older. This is where you discuss what do I do next? How do I navigate from where I am to where I want to be? And so we facilitate a decision support process, meaning we don't make decisions for our consumers, but what we do is lay everything out for them to help them make the best decision that they can possibly make. What we do is we put everything in their hands, and then as you put it in their hands, okay, now what is going to best benefit you? So that's what options counseling is. And so and also another thing that we do is we option counsel with family members when they are when the fork is in the middle of the road and they're like, okay, my dad's coming home from the hospital and the doctor's recommending that we put him in a nursing facility, but I promised my dad that I would take care of him until the day he dies. And so what we do is have real conversations with consumers so that they understand both sides, the benefits, the downfalls, what it's going to look like. We give them resources for support so that they know that it might not be an easy road, but if that's a preference for them, that they're making the best decision for their long-term choices in care. So that's what options counseling is. And then we have the benefits counseling. Benefits counseling is similar. Well, this is the part that goes with the special Medicare programs, right? And special Medicaid programs. The benefits counseling comes with that. One of our busiest times is during open enrollment. Open enrollment is typically from October until December, right? Starts like the second week of October and it goes to the first week of December. typically. And what happens? It's time for Medicare beneficiaries to decide, am I going to stick with original Medicare? Am I going to choose an Advantage plan? What is going to benefit me with my next steps? This is where we navigate through advanced directives, veterans benefits, employee insurance plans. I remember, I think I told y'all my mom is turning 70. I'm so proud of it. I mean, that to me is awesome because it's only certain days that are, that you are expected, but people's lives are getting longer. And so I remember when she first turned 65 and she was like, I gotta fill out this stuff. Well, guess what? I'm a benefits counselor, Mom. Let me help you with this. And she thought that she had to um, give up her insurance and all and everything. And I was like, no, you don't have to give up your insurance if you're still working while you're getting Medicare or Social Security or whatever. There's ways to navigate through that and not receive a penalty. So a benefits counselor's job is to help them navigate through those decisions, making sure that whatever prescriptions that they're on or whatever, that they have everything that they need. So that's what a benefits counselor does. I hope I'm not boring y'all. This is a lot of information. And then we talked about long-term planning. Long-term planning is for people with disabilities and children that may are getting ready to transition from child to adult, especially a lot of consumers that we deal with. They work with a lot of the parents work with the special ed departments. And so when they get ready to transition from the special ed department um, to the adult department, they call us because they have to apply for services. They got to decide where their child is going to live. They got to decide how things are going to look. And so that's very important. So that's, and also when a family member or the person is trying to decide what they're going to do. Are they going to sell their house, move to an assisted living facility or a senior community? They call us to help them navigate through that. Legal issues, home modifications. Our sister, remember I told you about the Harris County Area Agency on Aging? They help with home modification. So whatever we can't do, we got the other agency that assists with that. Okay, and let me tell you about the local contact agency. The local contact agency is who we are, and basically what it means is when someone decides that, let's say somebody's in a nursing home, right? And they decide, you know what, this is not where I want to be. I want to move back into the community. I want to live the rest of my life out in the community. They call us during that time so that we can assist them relocating back into a community residence. And it just depends on what it looks like. So that's what the local contact agency is. And then this piece right here, oh my goodness, housing navigation. Okay, so let me tell you what we're not before I tell you what we are. We're not a find it, we're not a HAR, and we're not a real estate agent. Okay, what we are advocates that help people find accessible and affordable housing. We advocate for them. Right now, we are planning a housing summit for this year. And the purpose of the housing summit is to see, how can we as a community, as agencies, make sure that we're addressing all the needs and that the undeserved population have, which are, and I'm not just putting that like that. I mean, but the people who are disabled and elderly, what are we doing to address those things? How can we make their lives easier. How many developers are coming up in the Harris County area, and how many of those developers are going to make things affordable and accessible? Everybody on this line probably knows how much it costs, rent and mortgages cost right now. And so our job is to make sure that it's affordable and it's accommodating for this population. So that's what the Housing Navigator does. And then this part right here, all of us, is a research program that I personally have been working with the Harris County Area Agency on Aging on, and it's about precision medicine. It is an initiative that will last for 10 years, and the goal is to get 1 million people signed up for all of us. All of us is to help researchers and doctors find precision medicine that works with us, with our ethnicity, our culture, our background, that will help us, instead of giving everyone the same medication, cultivate medication that works for the person and not for the biometrics or the pharmaceutical sales. So that is what all of us is. I won't go into too many details about all of us, but you can find it easily. Google all of us research and you'll find so much information. Yes, I'm a part of it, and I love it. It's just send you little quick surveys. You fill them out, and once you finish filling them out, you go to the next phase. It's just phase by phase by phase. So it's very, very informative. First time being a part of a research program. And this slide right here is about our health department, our COVID-19 vaccine access project. This number, anybody can call at any time to find out about any new information, if they're looking to be tested, if they're looking to be vaccinated, if they just need to get in contact with the health department about certain things, this is the number that you call for this. And this is our contact information. So you can reach us on the website. Our website is www.careconnection.org. On there, you'll find a plethora of information, and you can also leave us an email. I'm in charge of the email, so you're welcome to drop any information in there, and I'll get back to you within 24 hours. And then this is our number right here. It's 1-855-937-2372. Remember, this is a nationwide dialing. So whatever zip code you put in, that's where they're going to send you to. Okay. And I hope that I've answered all your questions. If you have anything that you want to ask me, is that okay, Dr. Peggy? Okay.
Absolutely. Seth has been watching the chat box, and so I'll turn that over to him. But why don't you stop sharing, and that
Yes,
way everybody's little, there we go. So if any of you have a question, you can either put it in the chat box or you can raise your hand with the little icon.
And you're welcome to unmute and ask away, please.
Hi, good afternoon, everyone. I'm Anna. I am with a nonprofit here in Houston. And my question is, does Care Connection actually have maybe partnerships or like network with nonprofits like us? Our main focus is definitely people with disabilities and how to help them find people like you. So like we're trying to work our resources and be able to connect with members so that we have somewhere to send them to find doctors, programs, and all that. Do you guys, so like, could we partner up? What do you?
That sounds great. What I can do is I will can I put my email in the chat?
I would love your
Absolutely.
email.
Okay. I just gotta find what it's chat is.
Should be at the bottom.
Or if you want, I can put your email in the chat
That would
while
be great. Yes,
yes.
that would be great.
I'll go ahead and do that while
Okay.
you're continuing to address any other questions that may come up. And as far as partnerships, anecdotally, we maintain a what's called our CARES resource guide, or just CARES resources in short, which is updated from time to time as questions about care and community come to us here at the Open Healing Center and Institute. And we certainly go ahead and make reference to the Harris County AAA, to Care Connection, to the Long-Term Care Ombuds Program. These are all places that we absolutely want to make sure are no secret to folks who are in current need or anticipating a future need, as far as their stages of life are concerned.
Yes.
Okay, that is great.
Anyone else with
Yeah.
questions?
I don't have a question, but I want to kind of introduce myself so you can have a face with the name. I am Stephanie McCoy. I am with Adult Protective Services. I am the
Hi.
faith-based and community engagement specialist. And so I have two team members in the Houston area, Eunice Adijo and Daniel Bernal. And so I cover the whole state, 254 counties. So I'm the team
wow.
lead for community engagement. And so this was a very informational meeting. You did a great job, and I just wanted to introduce myself and say you did well.
Thank you. Thank you so much. Please feel free to take my email, and so we can connect, because
Yes.
as I stated, we are in May. We're going to have a housing summit, and I think that it will be very informative for a lot of agencies. I think that that's something that a lot, well, all over Texas, I know, is dealing with housing issues, and the areas that are being regentrified, the areas that, where the housing market is going up so high. And then when you're on a fixed income, you have to be, what's the right word? You got to be creative.
Yes.
And
Yes.
your resources have to become creative, because at the end of the day, there's a problem, and we have to figure out, how can we solve, my director always says, if you come with a problem, also come with a resolution. And so our jobs are to give them a resolution.
Awesome. Thank you. I'll put my information in the chat as well.
Okay,
Please
great.
do. And I see that Christine Chow has asked if there is a website where more information about the upcoming housing summit may be found. So if that's something that is readily accessible, wonderful. Otherwise, what I would suggest, Christine, is to reach out directly to Tanisha for said information, and she can certainly pass that along.
Yes.
I'm a storyteller, and one of the things that I love to hear are when people seeking assistance get assistance. It isn't just about making sure that the task of helping them is performed. It's about making sure that we improve society as a whole in the process. I'd love to hear, and I don't want to put you on the spot, but if there are any highlight moments that during the 8 years you've spent and counting at the ADRC, that you'd like to go ahead and share as you can share, without, of course, breaking any confidences, that really highlight a lot of what you have mentioned today in your very thoughtful presentation.
Sure. Honestly, there are so many stories that I could tell. But I will say this, and I'm going to call her Miss A. For about 3 months now, let me say this. When I first started at the ADRC, things were a little different because initially we serviced all 13 counties, all 12 counties surrounding Harris County. And so now things have changed progressively. However, I remember being in a place where I felt like I was maybe Wonder Woman. I'm gonna say Wonder Woman, where I had to do everything because it was always something. And as you learn and with experience, I like to say that we gain the spirit of discernment. And so we know when to move, how fast to move, and how to move, right? So recently we've been dealing with Miss A, and Miss A is originally from Michigan and migrated to Louisiana. Okay. And so Miss A migrated to Louisiana, raised her children in Louisiana, and eventually had several chronic illnesses that came up. In the process of her having several chronic illnesses that came up, she decided, one of my daughters stays in the Houston area, so I'm going to move to the Houston area. And so she did. She moved to the Houston area, and her intentions were to stay with her daughter. Upon staying with her daughter, maybe two of her daughter's kids contracted COVID. And so with chronic illnesses, Miss A ended up in the hospital. And after she ended up in the hospital, she didn't want to go back to her daughter's house because she has chronic illnesses. Her daughter has small kids. Having small kids, they like to touch you with unclean hands. I got two of them that like to touch you with unclean hands. But she ended up sick. So Miss A made an executive decision. Now, this decision was not made with us. This was made by Miss A. Miss A decided that she was going to move into a boarding house, right? And so she moved into a boarding house. Now, remember I told you Miss A she migrated from Michigan to Louisiana, right? Forgot to tell you Miss A is on Social Security income, not Social Security disability, but Social Security income. With Social Security income, something else comes with it, Medicaid, right? So Miss A, Louisiana to Texas, right? Moves into a boarding house. She's given this boarding house the majority of her money. Now she needs assistance. She needs transportation, right? She needs assistance with her prescriptions. She needs food. She needs help, right? And then on top of that, Miss A has ID from Louisiana. So now she needs assistance with getting an ID. She stays in a boarding house. This is how the different components come together, right? So initially she calls and says, I gotta get out of this place. That's the first thing she says. And so initially she says that this was during the freeze. This is when we first start talking to her, right? There's no heat. There's big rodents running around. She has asthma. She's COPD. Now, anything you know about asthma and COPD, when you're around rodents and stuff like that, it flares up, right? So I'm thinking, oh my goodness, what are we gonna do? Well, can you go stay at your daughter? No. I can't stay at my daughter's house. Okay, you can't stay at your daughter's house. So now we're trying to figure out what to do. Well, guess what we did? We called Adult Protective Services, right? Because she said that it was really bad. It was really bad. We called Adult Protective Services. Adult Protective Services goes out and she refuses, unbeknownst to us, she refuses services. She refuses services from APS. So now we're back at square one. So now she's calling us. So we've gotten her transportation. She has her transportation. She's gotten assistance with prescription assistance, but this housing is an issue, and these prescriptions are going to be an issue again. And we've gotten her home delivered meals because our agencies are working together, right? We're working together. She's 62. So we're working together to make sure that she has everything that she needs. Well, this ID is becoming a problem because, and if I could, I would, this is one of the things right here on my desk. It's becoming a problem because she needs an affidavit signed. So I'm advocating for her. So we advocate for her, and we call the local DPS office and they don't want to talk to us. So I have to go over their head now. So now I've been in contact with the supervisor of the corporate office in Austin. And so now we're gathering all her information together. We've had everything notarized. We've sent it over there so that they can see it. So everything is being checked off. And now that everything is being checked off, showing that she has what she needs, they're going to set her an appointment so that she can get her Texas ID. Right now, we've called Social Security and seen what she needs to do to get her Social Security transfer. But what our job is to always try and complete the process. And if we can't complete the process, put them in the hands of somebody that can complete the process.
Now, you raised, first of all, great story. And because you touched on so many different components of your presentation, as well as partner agencies throughout the state that enable the kind of transformation, really, that you're describing in terms of quality of life to occur. Because Medicaid is administered on a state-by-state basis, I imagine you also had some hoops to go through in terms of making sure that her Medicaid now qualified for benefit recipient in being a benefit recipient in Texas, where
Correct.
before she had applied for and successfully became a benefit recipient in Louisiana. I say this not to say, that you missed anything, but actually to champion what every person has had to do along the way to get her to this point,
Yes.
while also respecting her autonomy, even if she makes a decision that doesn't help agencies like yours further the process. You're still championing her right to go ahead and to decline, in this case, the services of APS. And say, okay, what else can we do to go ahead and to work collaboratively in order to make sure this person's autonomy as well as dignity are respected as we improve their life?
Correct.
I love it. I love the story. I hate that she was ever in this situation, but I'm grateful that to the extent that she wished to receive assistance, different avenues of assistance were made available to her directly or through a direct handoff.
Yes, I forgot to tell you this part. That she came in and her papers were not notarized correctly. And so we had to help her fill them all out again. This is something that we don't do, but this is something that we did because we have a notary on staff. The notary and another person met her in front of her house to have the papers notarized because they weren't filled out correctly. But both agencies, our goal is to see the full circle of a person, right? And we go to extra measures to make sure that a consumer is complete. If they, whatever it is, we try to assist them as much as we can.
Love it. And I'm deeply appreciative of not only the total effort that was done by every person in this chain of assistance, but again, the idea that this is something that we need to go ahead and to continue to help on a day-to-day basis. I imagine you get similar programming challenges, similar resource challenges from individuals. And every individual case is unique, but as we know, there are trends. And being able to help someone to demystify the process of getting to a place where they feel more secure because they are, in fact, fed, housed, medicated to the appropriate levels that they wish to be. It's an enlightening moment for all of us to understand what it takes for folks' basic dignities to be met.
Yes, sir.
Yeah. Any other questions from those in attendance, either through chat or if you'd like to unmute and ask? We've got still got some time allotted to us today, and we'd love to hear from you. And there is no such thing as a wrong question. If there's any information, for example, in the presentation that you need reinforcement about in terms of acronyms, I used to work in state government before coming to the Hope and Healing Center. I know how much agencies love acronyms. If there's anything we can decode, and I will go ahead, and again, I did go ahead and address this in the chat, but not only will today's slide deck be available to all of you who registered for today's Lunch and Learn, we will send that with a link to the recording that we're making of today's presentation as well. And that should be heading your way in the next few days. So keep an eye out on that. And if for some reason you don't see it, take a quick peek inside your spam or junk folder just in case it ended up there by accident. All right. Well, thank you again so much for what you do and for how you have explained the journey that people can take to get to a place holistically of better and health and security. And I wish everybody a good remainder week, and I hope that you can't go to the rodeo anymore, but I hope that whatever you do this weekend, it is kind, gentle, and of course, filled with rooting on the Cougars. So you do whatever you need to do, regardless of your alma mater, to go ahead and to just wish on our hometown team in the NCAA tournament. Okay, and I don't just say that because I'm a proud father of a future Coug, but we've got some good sports going on.
Yes, we do.
Thanks so much, Tanisha. We really do
appreciate. Thank you for having me today.
Stay dry and safe out there.
You too.